Hello, I'm Ben Galetka. I'm a member of the AAOMPT nominating committee, and I'll be conducting the interview of Elaine Lonnemann, who is seeking re-election to the office of President of AAOMPT. So we're very excited to talk with you today, Elaine. First, we'd like you to tell us a little bit about yourself and your professional background. Please be sure to include your clinical and academic roles, as well as association roles or participation in AAOMPT and other.
Absolutely. And, really thank you for the opportunity to meet with you and to have this opportunity to speak to the membership. I really look forward to it. At this point, I'm unaware of any opposition. However, it's just a great opportunity to speak with you and let you get to know me better. And as always, I like the opportunity to get to know the members. So my professional background has been, I graduated in 1989 from the University of Louisville physical therapy program. I graduated with a bachelor's degree and decided that I wanted to be mentored. That was some of the advice the faculty gave me at that time. So I moved to East Tennessee and practiced with some individuals who had their masters in orthopedics. And they directed me into, they knew I was interested in orthopedics and directed me to take some continuing education courses and primarily, made recommendations based on orthopedic section at the time, and also introduced me to an individual named Stanley Paris. And that's where I started my education in manual physical therapy. It was in East Tennessee, and taking some of the continuing education courses. And while I was there, I was treating a lot of patients with low back pain and really felt like I wanted to learn more. I was really interested in the manual physical therapy courses I was taking at that time. So decided to go back and do a residency and work on a master's degree, mainly just because it kept me going. I didn't feel like I needed, ad infinitum degrees, but it gave me goals. And so it kept me on track. And I went to start my master's degree with, at that time, the Institute of Physical Therapy, and started my residency/fellowship training, because at that time, that was the portfolio basis for the fellowship. So had the opportunity to practice 3 years with Stanley and Catherine, and Ken Olson was another resident at that time. So really was mentored well and encouraged a lot about leadership and really excellence in clinical care. And so I practiced there for a while. I moved back to Tennessee, and overall my professional practice has been in outpatient orthopedics. I started a private practice in Tennessee. I've also had an opportunity to start a private practice in Indiana. So, overall, it's been mainly private practice or outpatient practice. I did also was an outpatient physical therapist at a level 1 trauma center here in Louisville. So I had an opportunity to practice a little bit differently in some different outpatient settings, not just private practice. I've also done home health. I've done bits and pieces of consultation for skilled nursing facilities. And when I moved back to Louisville and to home, one of the interests that I had was teaching in the first professional program at, it wasn't the University of Louisville at that time, it was Bellarmine University. And so long story short, I thought I would just start teaching one class, but over time I ended up teaching for 15 years at the Bellarmine University first professional physical therapy program, and loved teaching. I've always kept clinical practice. I'm still certified in orthopedics through the APTA, and have been an APTA member as a student. I was one of the student leaders in the APTA, and really have just kept involved and enjoyed the clinical practice and being able to tell the students the stories as a clinician. So I've maintained that activity, and also, like I said, the certification in orthopedics. My introduction to AAOMPT was back when I was a resident and fellow. So, taking me back into that period, I actually started in '93 as a member of AAOMPT, and that that story. Many of you have seen, the activities that I've done and the service that I've had for AAOMPT. But so, for my professional career, that's where I was a couple years ago. I've had some recent changes that maybe some of the members know about and some may not. I, about 2 years ago, applied for the Transitional Doctor of Physical Therapy program at the University of St. Augustine and took a remote position. So I work in Indiana, but travel to St. Augustine intermittently as the program director for the transitional DPT there. And about 6 months ago, I took the associate dean position for the interim, and so for the College of Health Sciences. So that has also been kind of a new opportunity for me. And so for the last 6 months, I've been, the College of Health Sciences at the University of St. Augustine consists of the MHS, MHA, EDD programs, as well as the post-professional OTD program and nursing, including the transitional DPT program. So that's been a leadership opportunity for me in academia that I've really enjoyed. And I've had the opportunity to use the skills that I've learned, or the didactic content that I've learned in the EDD program. I started that a couple years ago as well. So in higher education leadership and management, and that's been a great opportunity to inform the activities that I'm doing right now. And so I guess professionally, APTA member. I'm also I'm a delegate, not the chief delegate. I am the delegate for Kentucky. In fact, this is my first year in the House of Delegates as a delegate. And I've been attending as AAOMPT president, but this will be my first year to actually be able to go in and vote. And I've been reviewing all the motions that are coming forward for the virtual House. And so that's, I guess, my professional experience related to externally from AAOMPT.
Okay, the next question is, what is the best advice that you've ever received?
Oh, being the youngest of 9, I've received a lot of advice, probably some you wouldn't want to hear about. I think the best advice I've received is to really know yourself. And this came from my parents. Know who you are, and then be true to that person. And I think that, and that all those conversations, and I think the faith process that I grew up in terms of, a faith-filled family and a community, they really valued the opportunity to reflect, to know who you are, to know what your morals and values are. And that gave me an opportunity to not only, know myself, to understand who I am, but also reflect on how I could improve and be the best person, with the gifts and the things that I've been given. And I think the other reason I feel like that was really great advice is because it's given me confidence and in who I am, because I know who I am. I know who I'm not. I know who I want to be with, who I don't necessarily want to be around. But it's also given me, I think, a better ability to see the strengths in others, and to help them to understand, that it's important to be themselves and to see their own talents. Everybody's talents are different, and weaknesses, strengths are different, but really to see their talents and to encourage them. So I think, it was great advice because it gave me a foundation for knowing me and being able to stay in my lane and not feel like I had to be anyone else, whether it be in a leadership position, whether it be in clinical practice with my patients, because I think just being authentic, people really respect that, and also understand that you respect their authenticity. So I would say that's probably the best advice that I've been given.
I think you've already done a lot for our organization, and we're very grateful for that. but I'd like to know, what would you like to accomplish during your service if reelected, and how will you achieve those goals?
Yeah, thanks for that question. In terms of kind of what I've accomplished, I don't need to go over that, but I will say I came into well, I served as secretary for 6 years on a great board, and we had a great leadership. I came in, I was invited in as a secretary for 1 year and was elected for 2 terms. And during that time, I really got to understand the functions and the processes within AAOMPT and the governance, but kind of the governance activities. So that's always been an area of interest for me, and also was a primary goal for, Bob Rowe was the president at the time, and Tim Flynn, and that was our strategic plan to really strengthen the governance and our policies and procedures at that time. So I'll say, coming into my last presidency, I had more of a functions view in terms of how things worked, and maybe even a mindset on functions and governance. And I guess coming into the last 3 years, I really recognized that really for day one that I needed to have a strategic view of where the organization would be in the next 3 years and where we would be going, and really leading the board and working with the board, listening to the board to make sure that strategically we were where we wanted to be, and to be in a strong situation in 3 years. So I guess when you ask me what I would like to accomplish in the next 3 years, I would like to build off of that strategic planning, because I think one of the things that we really recognized is that in order for AAOMPT to survive, to be strong, to be respected, there were a lot of initiatives that needed to take place, and we started with we started with collaboration with AVTRI and APTA. We had been doing that all along, but had more opportunity in the last 3 years, especially I'd say the first year and a half of my presidency, to collaborate with them, develop our relationships, and really convey who we are as members of AAOMPT. And I think we've done that in a very positive light. We have a good working relationship with APTA. We have a stronger relationship with IFOMPT, and under Ken Olson's leadership and under all the leadership within IFOMPT, we've gotten to know that association more, and are also understand the IFOMPT standards and are able to collaborate with them for our programs, because it's our members are important. Our programs are exceedingly important, because they are the ones that are driving excellence in OMPT practice, and that's our mission, right? So I think, long story short, to get there, I think continuing to support the programs, which is something that we've started, but continue to listen to the program directors, the fellows in training, the members, and really ensure that we are able to get the word out about who we are. So I think some of the other initiatives, we've done some press releases. We're working on some more, or we've done a press release related to degenerative disc disease. So I think it's going to be really important for our members and for the clinicians that the public and our profession really understand who we are and what we do, and see us as humble practitioners who are doing the best we can in terms of research, clinical decision making, sharing our knowledge. And we're not an elitist group. We're an open, armed group of individuals and members and association that really wants to collaborate with many other associations. And in doing so, I think we will really get the word out about who we are to our profession and to the public. And I think that is what our members are looking for. They want to have a good, strong practices. They want to be able to treat the patients the way they feel like is appropriate to treat the patients. And so, I think continuing continuing the strategic initiatives that we have started, and providing a strong foundation for the association are things that I would like to do. I mean, there are a lot of other, I think that we've improved in our strength in our committee work. I think I've never seen such activity and, just really ability for members to come together, and there's so much work going on, so I think that has become more organized in the last 3 years, and I really just would like to see that move forward. As far as committee, not just the work in the committees, but actually the leadership and the governance of committees, and them being able to pull in new members and have the ability to lead them and have a strong succession plan for each of the committees, because all the committees are extremely important, and I think that's they're all very active, and they've got a great they've got policies and procedures in place. Not that that's all about policies and procedures, but I think they really have their vision of what they want to achieve, and that just brings the entire organization to a different level. So I would like to continue to promote that. One of the things that's always been a passion of mine is developing a leadership program within AAOMPT, whether it be in collaboration with APTA or another group, a private practice group, section group, just to really ensure that our leaders, our members, have the opportunity to get education in leadership, to be mentored in leadership. Because what we don't want is, we don't want it to be, well, here are the leaders and here are the members. We need to have succession planning for our members, and we also need to gradually build all of our members, because I think, regardless of what profession you're in, just from a personal standpoint, if your vision is that of yourself is that you want to lead, whether it be leading yourself, leading your family, leading an association, leading a clinic, or maybe just leading yourself to do the best you can clinically, I think that is something that I would like to see all our members have an opportunity to partake in, is some leadership training and the ability to be mentored. So that, I think that's another thing. One other area, and I don't want to talk too long, but I will say that I would feel like, if I didn't continue what I had started, I would feel like there was I had kind of left a blank hole, because we started the Foundation for Orthopedic Manual Physical Therapy, and its role is to work with accreditation, and also to increase the awareness of the public and the profession about who we are, about what manual therapy is, and the benefits of the research related to manual physical therapy. And so I think really I would like to help continue to establish, although we have excellent leaders in those in the Foundation of Orthopedic Manual Physical Therapy, but I would like to remain on the board to assist them to meet their goals and to establish their strategic plan. And they also, as I mentioned, have oversight for the accreditation agency, and we've started the accreditation council for AAOMPT education, so AAOMPT, and also has a really strong group of key leaders on that board. And I would like to assist in seeing that group move forward and have a strong governance plan and have a very collaborative opportunity, or collaborative approach, which I think that they do with accreditation, because it can be a very collaborative approach. And I think that will just enhance the ability for our fellows to learn and our programs to lead, and really increase the excitement to be a member and a part of AAOMPT. So I think those are the primary areas. I know other initiatives we're working on are a task force. I just started a task force that's going to be led by Jason Silvernell and Jason Rodegaro and Gail Dial as the board liaisons, on defining what OMPT is. And so we'll have more opportunity to be able to succinctly convey that to the public and to our profession. So I think those are the main things. There's quite a few other smaller things, but that's the primary areas that I really want to work with in a collaborative environment with APTA and with AAOMPT and with other associations.
Okay, we have one final question for you today. I like this. This is a special question to ask. So, what legacy do you expect to leave after serving as president of our organization?
Oh, I guess the legacy I would like to leave or hope to leave is related, I think, to inclusivity. And surprisingly, I've had a lot of, surprising to me, I've had a lot of people come to me and say, you know, thank you for your leadership. You've really inspired me because of my XYZ. And maybe I felt like I was, and when I say, you know, maybe my gender or maybe my, you know, situation in clinical practice, that I feel like I do it. And so I think the legacy that I would like to leave is, you know, to inspire all individuals to not only lead, but to feel included as members. There's no reason that we can't all work together in a environment where, you know, we don't all have to agree, because you know, there's a lot of strong personalities in our association, but I would say being able to agree to disagree with respect, and to respect individuals even if they have a different opinion or you know, thoughts about research or thoughts about clinical practice. And so I guess, you know, being inclusive and also, you know, being inspired to lead and to be active and to be welcomed. So that would be what I would like to leave as a legacy. And I think part of that would also includes communication with each other, and thoughtful communication, very transparent communication. And I would hope that that would be something that would, you know, continue, because I think you can't, if you're not transparent, you're not open in communication, it's difficult to make people feel that they can trust the leadership or trust other members in the association. So it's a great question. Thank you.
Well, we'd like to thank you, Elaine Lonnemann, who's running for re-election and for the office of President of AAOMPT. We appreciate your time, and we appreciate your willingness to serve. Thank you very much.
Thank you. I appreciate it.